Hi, I'm Dr. Grant Lepley, optometrist at Family Focus Eye Care, and today we'll be talking about children's vision. This may surprise parents, but we generally recommend that kids come in for their first eye exam between the ages of 6 months old and a year old. We are actually all infancy providers here, the 4 optometrists at Family Focus, and we do these exams free of charge. At an infancy eye exam, we are just evaluating the child to make sure that they don't have any real high refractive error or nearsightedness, farsightedness. We want to make sure that they don't have any risk factors that will set them up to have like a lazy eye type situation. We also check the health of the eyes just to make sure they weren't born with any major defects such as congenital cataracts or other significant health issues. So at the pediatrician's office, they are generally using the Snellen eye chart to check to see if the child is nearsighted. Nearsighted basically means they have difficulty seeing far away. That's a great test, and it's very useful in catching these kids if they haven't had an eye exam, but it's missing a lot of children as well that may be farsighted. Farsighted kids will pass that test pretty easily for the most part, but they may have serious issues focusing when reading. They could be labeled as attention deficit in school because they have a hard time concentrating when they're doing school assignments. It also wouldn't catch kids with binocular vision issues. Binocular vision is how the eyes work together as a team. And for instance, convergence insufficiency is a fairly common problem in school-age children where their eyes have a hard time turning inward to focus on reading material. And that's another thing that can cause a child to fall behind in school or potentially have behavior issues in school. These are all things that we would evaluate for at a comprehensive eye exam at our clinic that would be missed at the pediatrician's office. Headaches are a common issue that is brought up by patients of all ages, from kids to adults, and it can be a difficult thing to pin down what the true problem is. But eye exams are always a great place to start, because if the eyes aren't working together well or we're really straining to see, that's a common cause of tension headaches. A part of many eye exams is dilating the eyes or using eye drops to make the pupils bigger so we can see inside the eyes better. We don't always do that with children. We do it as more of a problem-based test if we feel we need to get a better look inside the eyes, or if we feel that we may alter the prescription based on the dilation results. Many kids have large pupils, and dilating the eyes actually makes it more difficult for us to see inside the eyes because they suddenly become very squinty. So it's something that we may do, but we always discuss with parents before we do that. So in closing, we hope to see you and your child soon for an eye exam. We generally recommend that they have their vision evaluated before starting school. If you come in for that infancy eye exam that we discussed earlier, if everything checks out okay, usually the next time is around 4 or 5 years old. And then depending on the results, every 1 to 2 years after that. If you have any questions about anything we discussed today or any questions about your child directly, you can give us a call at 920-922-7121 or reach out to us through Facebook.